Good afternoon and welcome to Let's Chat with Dr. Celeste MD. I'm your host, Dr. Celeste Reese-Willis. I am your board-certified family medicine physician. I assist busy professionals with finding solutions for their acute and chronic medical needs through my virtual medicine program, concierge medicine, national speaking, as well as through COVID-19 testing. Good afternoon, ladies and gentlemen, and welcome to Let's Chat. We're joining you today trying to bring awareness and to highlight prevention measures in relation to colorectal cancer. As many of you are aware, Mr. Chadwick Boseman passed on Friday and as a result of colorectal cancer. And so today we're doing this Let's Chat in honor of him in terms of colorectal cancer, as this was a diagnosis that he passed from. Now, most of you probably know Mr. Chadwick Boseman, and we pause at this time to send prayers and love to his wife and his entire family in lieu of his great loss. He is actually a real life superhero for several different reasons. Many of you know him. He's most acclaimed thing that people know him for is his role as Black Panther. He's also starred in other movies, Thurgood Marshall. He played Jackie Robinson, as well as James Brown. He also played in the Avengers. But the Black Panther was his most notorious role, and it definitely was my favorite movie of his. Some of you have been reading in news articles and have found that he was actually diagnosed in 2016. And during that time, he was diagnosed with stage 3 colorectal cancer. And during that time, he actually filmed all these movies that have been just incredibly inspirational. If you have not seen all of his movies, I implore you to definitely do that. The message that he gives with this is just phenomenal. Not only playing a superhero in a movie, but he's a real life superhero, because while he was fighting colorectal cancer, he was still living a life trying to inspire other people. Most notably, there's a video out about 2 young boys that were fighting cancer and that were trying to live long enough to be able to see his role in Black Panther. So he was still trying to be an inspiration and role model while he was dealing with his own personal battle of fighting colorectal cancer. And so, we are just saddened to hear about his loss, but in that effort and in that vein, we wanted to bring some awareness to colorectal cancer, because we all know that he was only 43 years old, which is a young age to have that diagnosis, as well as to pass from it. Not impossible, not unheard of, and we'll get into that in just a moment. So let's start off by talking about some of the signs and symptoms of colorectal cancer. So colorectal cancer, also known as colon cancer, is cancer of the colon. Now, cancer in and of itself is just the abnormal proliferation, or when cells that are normal develop in an abnormal way and they continue to proliferate in a way that is malaligned or malformed. Now, some of the signs and symptoms of colorectal cancer that some patients may know, and keep in mind that every patient that's diagnosed with colorectal cancer does not exhibit symptoms, but some of the people that do, or some of the things you want to watch out for, are these things. Now, if you have a change in your bowel habits, such as having diarrhea or constipation or narrowing of your stool for more than a few days at a time. So you may be out there and you're like, okay, well, what if I have constipation or diarrhea sometimes? What we're talking about is a change from your normal bowel habit to develop one of these symptoms, diarrhea, constipation for several days at a time, that your bowel movements are not normal or not like they usually are. We generally, have an idea of what our bowel habits are usually. So that's what you're going to look for, something that's different from your norm. The second symptom that some people get is feeling like they feel like they have to have a bowel movement. And then when they go have the bowel movement, they still feel like, I still feel like I have to go. So that sensation of a persistent feeling like you have to have a bowel movement is one of the symptoms that some patients with colorectal cancer will exhibit. In addition to that, you can get rectal bleeding or bright red blood on your stool. Now, you can also get dark blood, or like that's dark brown or black stools. that is a warning sign or symptom that you need to consult your physician right away to further evaluate that. In addition to that, you can get cramping or abdominal pain. Some patients with colorectal cancer will complain of having weakness or fatigue. Now, because there is a loss of blood in a lot of patients that have colorectal cancer, they can actually have anemia as a result of that. That's one of the reasons why on your regular exams we'll check a CBC. That's one of the reasons why we check a CBC, but that's one of the things that we look at in assessing, the risk of colorectal cancer. And that's from the loss of blood and stool. As a result of that, the patient can feel fatigue or have weakness. In addition to that, you can also get unintended weight loss. So unintended weight loss definitely is something that needs further evaluation and you having a visit with your physician. So let's talk about some of the risk factors, for colon cancer. Now, some of the risk factors we can do something about. Some of them, guys, there's nothing that we can do about them, but let's discuss that here. Moderate to heavy alcohol use is a risk factor for colorectal cancer. And when they say moderate to heavy, we're talking about a man having more than 2 drinks a day and a woman having more than 1 drink a day is considered moderate to heavy alcohol use. So that's a risk factor for colon cancer. Obesity is a risk factor for colon cancer. In addition to that, being older, although we're seeing it in patients that are younger, and we'll touch on that in just a moment, it is more common overall for colorectal cancer to happen after you're 50 years old. Being physically inactive is a risk factor for having colorectal cancer. So let's talk about our diets. There are certain diets that are a risk factor for colorectal cancer. And that's a diet that's high in red meats like beef and pork and lamb or liver, or in processed meats like hot dogs. And so what we mean by that, people that have a large amount of these kind of foods, red meats and processed foods in their diet, it causes you to be at an increased risk for colorectal cancer. It's said in some studies that cooking meats at very high temperatures, like frying or boiling, creates a certain chemical that may put you at an increased risk for colorectal cancer. There are not a lot of studies about that, but there are some studies out there that show that. In addition to that, let's talk about some other risk factors. Having low vitamin D actually puts you at a risk for having colorectal cancer, but not just colorectal cancers. Low vitamin D actually puts you at a risk for other cancers as well. So you definitely want to make sure that you know what your vitamin D status is. In addition to that, smoking is a risk factor for colorectal cancer. Tobacco smoking actually increases your risk for several other cancers, but definitely is an increased risk for people that have colorectal cancer. So now let's talk about screening. There are 2 screening methods currently that the American Cancer Society recommends for patients when we're looking at colorectal cancer. One of those is stool-based, and one of those is like a visual look at the tissue in the colon and the rectum. Stool-based tests there are a few of them that we use. One of them is called the FIT test, or the fecal immunochemical test. The second is a guaiac fecal occult blood test. Those 2 tests you perform every year as if that is your screening method. In addition to that, there's a stool DNA test that you run every 3 years. So that's one way to screen for colorectal cancer. And we're talking about screening in average risk patients. We'll go over in just a moment who our high risk patients are so that you know that, but we're talking about average risk patients now using a stool-based method or either the visual. Now let's talk about the 2 modes of the visual screening test for colon cancer, and that's when you visibly look at the colon and the rectum. Everyone most commonly knows the colonoscopy, which is what most people have. You do that for average risk patients once every 10 years. There's also in recent years a test called a CT colonography, which is like a virtual colonoscopy through x-rays as well as computers. They reproduce an image of the patient's colon and rectal tissue for the physician or radiologist to examine. In addition to that, there's a flexible sigmoidoscopy. And what that is, it's similar to a colonoscopy. It's a flexible tube that goes in your rectal area and looks at your rectal area up to your sigmoid colon. So those are the different screening methods for people that have an average risk. If any of those tests end up being abnormal, you automatically need a colonoscopy. Okay, so that's for average risk patients. Okay, so for average risk patients, we're going to start screening you. The current recommendation is to start screening for an average risk patient at 45 years old, and that they recommend that this can be done with either of those tests. Now, I encourage you to make sure I'm sharing this information with you, but this information is shared with the intention to bring awareness to this in an effort to try and prevent, and encourage you to make sure that you see your physician to find out when it is that you need to be screened for colon cancer, because the answer for each person is different based on what your history is. And you'll understand what I mean when I come back in just a minute for that. So we're talking about average risk patients, start at 45, can be done with either test. And it starts at 45 and you continue it until the age of 75 in patients that are in good health and with a life expectancy of at least 10 years. Okay, so you continue that to 75 years old. At the age of 76 years old, from 76 to 85 years old, you have to speak with your physician, and they will assess you and figure out, at 75, what's your past medical history? What is your risk for colon cancer? What are the other things in your screening history or your personal or family history that warrant you needing to be screened? Or do we need to continue screening, or do you have another diagnosis that would preclude us from doing a screening, i.e. if you had another form of cancer, or there are a lot of different variables there. So I don't want to go into that too much, but the important part is to realize that screening for the average patient from 45 to 75 is one of those three stool tests, or one of the three visual tests that we spoke of, most commonly the colonoscopy. Now, after the age of 85 years old, there are no recommendations by the American Cancer Society for colorectal screening. Okay, so that is talking about the average risk patient. So now let's talk about people that are at high risk. Now, this is a part that's very, very important. If you're listening to this information, if anything that I'm saying to you, especially if you have family history, please share this information with your family members. You can tag someone now and share it with them. But in an effort, I think that we would do best by honoring Mr. Boseman by bringing awareness to this. And part of the purpose of this is to enlighten you about how important it is to know your family history and to vigilantly go after it and find it from your parents, grandparents, etc. So people that are at high risk are, number one, people that have strong family history of colon cancer or certain kind of polyps. Sometimes when you get a colonoscopy, you may be told, oh, you have a polyp, which is a growth of cells that they find in your colon that could possibly be precancerous. So if you have strong family history of colorectal cancer and or family history of certain kinds of polyps, you are considered to be high risk. If you yourself have had colorectal cancer in the past, or you've had polyps before, this puts you at high risk for colorectal cancer, okay? And generally, if you have personal history of colorectal cancer, you get in with a good GI doctor. They follow you on a regular basis. You'll get screenings, and, just make sure that you stay seeing your primary care doctor as well as the GI specialist on a regular basis, and you stay on top of that. That's very important. So those two groups are at high risk. In addition to that, people that have a personal history of inflammatory bowel disease. And what inflammatory bowel disease, that includes Crohn's disease and ulcerative colitis, okay? Those are two inflammatory conditions of the bowel, and that puts you at increased risk for having colorectal cancer. Typically, these patients are already seeing GI. They already have been given recommendations about how often they have a colonoscopy as a result of the Crohn's or ulcerative colitis, unless they're in remission. So just important, if you have that diagnosis, make sure you stay in tune with your GI doctor to get the necessary follow-up that you need, okay? Now, in addition to that, fourth group that's at high risk are people that have a known family history of hereditary colorectal cancer syndrome. And that's going to include people that have one of two syndromes, and it's the familial adenomatous polyposis or Lynch syndrome. and that's hereditary non-polyp colorectal cancer. So if you have one of those two syndromes, that puts you at increased risk for cancer. It also puts you at increased risk for other cancers with the Lynch syndrome. In addition to that, fifth group that's at higher risk for colorectal cancer includes anyone that has had a personal history of radiation to your abdomen or to your pelvis as a result of a different form of cancer. Okay, so those are the 5 groups of high-risk individuals: people that have a personal history of cancer and have had radiation to their abdomen or to their pelvic area, people that have a known family history of hereditary colorectal cancer syndrome, those individuals that have a personal history of inflammatory bowel disease, ulcerative colitis, or Crohn's. Secondly, someone that has a personal history of polyps or colorectal cancer. And then fifthly, those individuals that have a strong family history of colorectal cancer or strong family history of polyps. Now, for these group of individuals that are at increased risk, we start their screenings before they turn 45 years old, okay? So if you have family history of colon cancer, we're going to start doing a colonoscopy or some form of screening test on you before you turn 45. I encourage you, if you are 35 years old or older and you have family history of colon cancer, that you go ahead and you want to make sure that your doctor knows that. And typically families that have a really strong history of colorectal cancer, and when we say really strong history, we mean more than 2 people in your family that you know of have had colorectal cancer. That's a very, very strong risk of colon cancer, family history of colon cancer. So in those individuals, we want to make sure that you start asking those questions, start making sure that you get your annual visits sooner so that you can detect it sooner. In addition to that, these group of individuals are typically screened more often, and they get a specific test for their screening. Now, I encourage you, I know that there's a lot of different things that are out now because of technology, everything's virtual, and especially with us going through the pandemic now, I encourage you to make sure, if you have family history, if you are having any of these symptoms, that you make that appointment with your physician to find out, hey, when do I need to get screened? Let's not wait until we turn 40 to ask that question, because there are a lot of questions that you have to ask your family, everyone in your family, and not just your parents, but your grandparents on both sides, your brothers, sisters, cousins, etc., to make sure that you have evaluated the entire plethora of finding out what your family history is. I can't tell you how important that part is, but we'll get to that in just a moment. So next thing that we want to know is, okay, let's talk about staging of cancer. Now, when we talk about staging of cancer, that just describes how much cancer that you have in the body. That helps physicians to determine how they're going to treat it, and it helps them determine your survival statistics for survival. There are 3 different things they look at with colorectal cancer. They look at the size of the tumor, or the extent of it, or how many layers of your colon has it gone through. There's several layers of tissue that exist to your colon and rectal area. So the first thing they look at is, okay, how big is the tumor? How far does it go down? How many layers of the colon does it go through? They look at that first. The second thing they look at is, okay, has this cancer spread to the lymph nodes that are right near it? The lymph nodes that are right near the cancer. They look at that as a second thing. And thirdly, they look at, has this spread to distant sites or distant lymph nodes? And when they say distant, they mean distant organs like your liver or your lungs, which are 2 of the very common places that colon cancer metastasizes or spreads to. So Mr. Boseman had stage 3 colon cancer. And at that stage of cancer, there are varying levels of spread, but we do know that if it's stage 3, that means that it has grown into varying layers of the mucosa of his colon and rectal area. And it's possibly spread to the nearby lymph nodes, but it didn't spread to any distant sites. And so the reason that I go over that is that during the time, so stage 3 cancer is an advanced stage of cancer. Is it the worst stage? No, it's not. But is it a very complicated and very sensitive time, very important stage? Yes, it is. And it had spread, or he was diagnosed with stage 3 cancer, colorectal cancer. But at the same time that he did that, he was shooting all these movies. And to just know that the battle that he was fighting personally and that he was fighting medically, which is very challenging in and of itself for a patient to do, for him to have the strength to do that and still be a role model to two little boys who had cancer, still show up and make it happen every day for everything that he had to do as a wonderful actor, and serving as an inspiration in that role is it's just mind-boggling to think that he went through all of that and was going through all of that and did it with such humbleness and such grace, and just such strength, is just amazing. So definitely will remain in prayer for his family. Let's talk about now prevention, because Mr. Boseman passed away at 43, which is a young age. He definitely fulfilled his purpose, that God had him here. We definitely can all see that. But because he was so young and having it, one of the first thing that I thought of was prevention. He died you feel like, okay, he was taken away from us too young. And while it's never up to us, it's not even up to us as physicians here on earth. We're just doing God's work while we're here. But it just seems like his life was taken a little too shortly. So one of the things that I would like to focus on for the rest of just the few more minutes that we have here is on prevention, which is a very, very big, something that's very important for patients, and that's one of the things that I center a lot of my healthcare around for my patients. Because the reality is, and that's what I was getting to earlier, is that a lot of us need to ask that question and start the screening sooner. Now, let's talk about this prevention. If he had had what was called a localized tumor or localized cancer, at that stage, 90% of those patients have a 5-year survival rate. Okay, I'm going to break down what that means because it's going to help you understand the importance of the prevention aspect of this. So 90% of people that have a localized colon cancer have a 5-year survival rate. And all that means is that 90% of people that have a localized cancer, in other words, it's local, it's right in that area of the colon, right? So 90% of those people will still be alive at 5 years compared to other people that would still be, other people without cancer that would be alive at that moment of 5 years, if that makes sense. So we're saying that means that there are 90% as likely as people who don't have cancer to live 5 years after being diagnosed, because colon cancer is something that is treatable and you can go into remission. We have patients that do it all the time. The issue is finding it. And the way that we find it is by screening. And how do we screen? Patients have to come in and share with their physician and have that physical and ask, because a lot of times patients don't have symptoms. I know I went over the symptoms earlier about bright red blood, about weakness, about fatigue, about cramping, about a difference in your bowel habits of, all of a sudden you have several days of, diarrhea or constipation or a narrowing of the stool. That's kind of a sign. So we just need to make sure that we follow up on those things, in addition to making sure that we know our family history. You have to know your family history. And I know that a lot of times, a lot of people are not, there's some patients that just like he went through all of this and it never got out. I think it speaks volumes about the group of individuals that he had surrounding him, that they were discreet and kept that for him. In contrast, though, I want to say family history-wise, a lot of times people don't share what their family history is. So if you don't know what your family history is, go ahead and ask your mother, grandmother, cousins, aunts, uncles, whoever. Get the family history now, because the only way we know that we need to screen earlier and in essence, to prevent another situation like this is that we know that there's family history. Because the standard time that we generally screen people for colorectal cancer is 45 years old or higher. Now, in recent years, what we found out, there's actually a study that was done by the Journal of National Cancer Institute, and it found that people that are less than 55 years old are 58% more likely to be diagnosed with a later stage of colorectal cancer than older people. So what that means is that the individuals that are younger, that are having this progressed stage of cancer and that are dying, are generally people that may have family history. But if you're younger and you get it, there tends to be a later stage of the colorectal cancer. And so this means that the screening aspect of this is vital. 12% of colorectal cancer diagnosis cases are in individuals that are less than 50 years old. Now, part of the reason that there's a later stage in people that are younger, one of the main reasons is because there's a delay in follow-up. And why? Because you tend to not think that younger people would have colon cancer. So when they get blood in their stool for a few days, you may ignore it. Don't ignore it. Call your doctor. Let them know. Find out. Ask the question. All you have to do is ask the question. Leave it to your physician to determine, hey, do we need to do anything further? Okay? But don't have blood in your stool. Don't have some of these symptoms. Don't have family history and not ask the question. Lastly, people that have family history are at higher risk. Cancer in first-degree relatives, parents, brothers, sisters, is what we generally are concerned about the most, but distant relatives do matter. If you have 2 relatives in your family that have colorectal cancer, that is important to let your physician know. The first question you want to know is, any family history of colorectal cancer? How old were they when they were diagnosed or first started having symptoms? We typically will tell a patient that we want to screen them prior to whatever that age is that that relative was diagnosed. Okay? So those are the things that are really, really, really important in trying to make sure that we pay attention to, trying to make sure that we just ask the questions of our family members so that we know. And once you know, if you have, and a lot of people have apprehension with colonoscopies and things of that nature, guys, all I can tell you is we've been blessed to have this technology. I think that we should use it. It's a temporary discomfort, and to be honest with you, when you get a colonoscopy, for the most part, they give you some medicine that kind of makes you comfortable, and you have someone there that's with you that has to drive you because they have to give you that medicine. It's much better to have that screening test, have it early, because if they catch it when it's localized, remember we talked about that, when it's localized, it's just in this one little area, and if they catch it early enough, they can get the cancer out of that localized area. As we said, 90% of people who have localized colorectal cancer have survival rate at 5 years. So 90% of those individuals. So we need to keep that in mind. So let's talk about what can we do to prevent it? What can we do to prevent risk factors? What can we do to prevent colorectal cancer? The main thing, number one, I can't emphasize it enough. Know your family history, not just of colorectal cancer, but of any cancer and of any diseases. Colorectal cancer, heart disease, breast cancer, everything. Know your family history. Number one, the biggest thing that you can do, the biggest tool you have against this is to get a regular colorectal cancer screening, okay, at the appropriate age. If you have family history, you need it earlier than 45. I encourage you, if you're 25, know your family history, know when you need to, because you want to know when it is that your relatives started having the issue that it is that you're trying to decrease the risk of. Number two, eating healthy. Fruits, vegetables, whole grains, eating a diet that is low in red meat and processed meats. Number three, making sure that you pay attention to your weight. Obesity largely increases the risk of colorectal cancer in men and in women. So you want to stay at a healthy weight. Number four, and it kind of ties in with number three with the obesity, is physical inactivity. So we want to make sure that we stay physically active. You want to increase the amount and intensity of your physical activity to decrease the risk of colorectal cancer. Number five, alcohol. You're at higher risk when you drink heavily, especially in men. Men that drink a lot of alcohol are at increased risk of colorectal cancer. So you want to make sure that you're not drinking alcohol or consuming it in a high quantity or amount in heavy usage. And then number six, low vitamin D. Y'all, I cannot tell you how much. Vitamin D is one of my topics that I talk a lot about. And one of the reasons, as you see it coming up again here, it is tied into so many different diseases, and processes that go on health-wise with us, that it's important to keep an adequate level of vitamin D. Low vitamin D is associated with obstructive sleep apnea, colorectal cancer, COVID-19, diabetes. We could go on and on and on, right? So we want to make sure that we pay attention to what our vitamin D level is. Associated with an increased risk of colorectal cancer and other cancers when your vitamin D level is low. So that's all we had to share. Let's see if we have any questions here. Let's see here. Thank you guys for taking time out to join us today. Oh, wow. Miss Jones says, hi, Miss Jones. She says she's a colon cancer survivor. Awesome. Yay. That is awesome. So I'm sure that she's keeping in touch with her GI doctor and getting her regular screenings. Let's see here. Let's see. My husband, he has a question here. Let's see. How do I know if it was one of the syndromes you mentioned or not? I've had family members that have had colon cancer. How do I know if it was one of the syndromes you mentioned or not? He's talking about the hereditary colorectal cancer syndromes. The way that we detect those syndromes is through genetic testing. Whether or not you need that testing, you have to see your physician to determine if you need it. There's certain families that have a history of polyps and other things. And so you need to see your physician and find out, hey, do I need the genetic screening? And you would need it if we knew that other people in your family had that same information. Okay. Hi, Mr. Stevenson. He said he's heard that HPV may play a role in certain colorectal cancers. Is there any way of knowing? There is research out there that shows that HPV may have a role in colorectal cancer. There is not a lot of evidence for this, but it's definitely out there. I would say, is there any way of knowing? You'd have to be screened for both the HPV and the colorectal cancer at the same time, and or wait until those studies present themselves to draw a definitive correlation. It's not definitive now. Yes, vitamin D is very helpful, very important. Okay, she said, my doctor ordered Cologuard for my first exam. Is that safe? Yes, Cologuard is absolutely safe. Definitely keep that appointment, Miss Patton, and keep your follow-up with that. Miss Robinson says, my grandmother passed of colon cancer, and I've had 2 colonoscopies already. Should I have one every year now that I'm 43? Okay, Miss Robinson, so I'm not sure when you started having a colonoscopy or when your last one was. Typically, if there's a patient who has family history, and this is not always, just, I'm speaking in generality. I can't, in order to tell you specifically what is right for you, I'd have to do a consult with you to tell you that. But I will share with you in generality what happens with most of, or some of the patients that I've seen. And so what I mean for that, and what I mean by that is I don't have your entire medical history, so I can't tell you specifically and for certainty, oh, I know that you only have to have it this amount of time, if that makes sense. But in generality, if there's family history of colon cancer, that person will have a colonoscopy for some years prior to the first relative at the youngest age in that family. At that point, they will schedule follow-up colonoscopies for you, typically every 5 years. Sometimes they do it every 3 years. It depends on what they find. If they find a polyp, they may say, hey, we want you to come back in 3 years. So I would find out, Ms. Robinson, check with your doctor to find out what was your last report and what the last recommendation was when you needed to follow up. They typically won't do a colonoscopy every year unless there's something else that's going on. Like for patients that have ulcerative colitis as well as Crohn's disease, they actually start them about once you get the diagnosis of ulcerative colitis, they start screening you for cancer at about 8 years later. Typically, it takes about 10 to 15 years for a polyp or that inflammatory growth to turn into cancer. And so they catch it right at 8 years. So if you're someone that has ulcerative colitis or Crohn's disease, which are inflammatory bowel diseases, they typically will start screening you with a colonoscopy 8 years after your diagnosis for ulcerative colitis or for Crohn's disease. And they will let you know, they always let you know, the GI doctor always says, when is your next appointment? Okay, so I definitely would encourage you to check on that. Let's see, Ms. Short, she says, oh, I'm sorry, Ms. Shorts, her uncle passed away from colon cancer. And you have internal hemorrhoids and IBS, so I started screening early. Awesome. So just make sure, Ms. Shorts, that you keep up with whatever schedule they set for you. And the GI doctor, typically, they'll talk to you after you get the colonoscopy. You don't remember anything. So they talk with whoever, your spouse or whoever it is that goes with you. But they typically will type up a report so that you know, because you won't remember it anyway because you're out of it from the procedure. But they typically always let you know when you need to follow up. If anyone is listening and you don't know when that is, please call your physician and find out. If you don't have a physician, are more than welcome to see me or anyone else. Just make sure you ask the question to find out, hey, when do I need to be screened? Especially if you're young and have family history of colon cancer. Let's see. Her last one was at 35. Miss Robinson, you need to call your doctor, please. Okay? And find out when your next appointment is, because that's almost 10 years. Okay? Okay. The previous screenings didn't show anything abnormal. Okay, that's good that they didn't show anything abnormal, but because you have family history of colon cancer, even if it doesn't show anything abnormal, you still have to keep the screening regimen that they have you on. You still have to continue to do that. So I would just check with them. Please check with them, Ms. Robinson. Okay, great. You said you're already scheduled one. Perfect. Okay, perfect. Does anyone else have any questions? We're running a little bit over. I was hoping to do this in 30 minutes or less. But just really, really saddened by the loss of Mr. Chadwick Boseman and the enormous person and individual that he's been to all of us in the last 4 years that he's been battling colorectal cancer, which is just absolutely amazing. He definitely fulfilled his purpose. We want to send prayers of peace and love to his wife and to his entire family. And I encourage you guys to follow up with your physician. Make sure that you know when it is that you need to be screened. That's important. And that's all I had to share with you guys today. So I hope that this was helpful. If this has been helpful for you, I encourage you to please share this information with other people. If you do have relatives that seem resistant to getting screening, then you need to make sure you find a physician that they are comfortable with talking to and speaking with and having that conversation so that we can make sure that they're screened. This is not a colonoscopy is not a painful screening, and there are other measures by which they screen that are not painful, but it's just necessary, very necessary for us to take the step and take the time to do that, to protect ourselves and to protect our family. And that's all I had to share with you guys today. I hope that everyone has a great day. Thank you all so much. I see all the thank yous in the chat box. And so because we run over, we're going to close things out today, but just encourage you guys to please stay encouraged. And let's continue, because Mr. Boseman, basically, he was inspiring us when he was here as Black Panther. And we see now a whole nother level of inspiration that he's provided through who he was as a man and as a human being, and who he lived in his private life that we had no idea about. And yet and still in his passing, he's still inspiring us now. And so I think that we should take that and let's do something positive with it and enact change in other individuals that are here on earth that we know that need that screening. At the very least, we can do that. Okay. If anyone's out there and you need an appointment or need an appointment with a primary care physician, I'm more than happy to serve as a primary care physician. We will start seeing patients in the clinical office at the end of next month. And we are providing telemedicine services if anyone needs consultation in that regard. And we also are continuing to do COVID-19 testing. I hope that everyone has a great day. We will chat with you later. If you have any other questions, you can put them in the chat and we'll have a good day. All right, everybody have a good day. Bye. See you later.